So one of our focuses is helping physicians start up practices, merge with other practices, especially with people who are new grads, move into a new state, or departing a hospital system. And so we try and take the practice from about minus 180 days to about plus 120 days. Once we've reached that milestone, that's typically, you should be up and running, moving along at a good clip by that point. And so we'll try and take you through these milestones. It's not going to apply to every practice. Every practice is a little bit different depending on the specialty, depending on the location, the size, the scope, for example. And so you can always reach out to us for this kind of checklist or for any assistance that you might need. So we'll start with 150 to 180 days out. And so, we typically like to let the experts do the expert jobs. And so if we need to hire legal counsel to form our business, let's do that. We should, if it's a partnership or a group, there needs to be a way to get in and there needs to be a way to get out. And there are business law attorneys, some that is specifically in healthcare, but it's not a requirement. What's our operating agreement going to look like? What's our business structure going to look like? What's our shareholder agreement going to look like? How do additional partners buy in? How do we get people out? How do people retire? What happens to their shares when they do? And so all these kinds of things ought to be dealt with before we even do step one. And so, and a lot of times, like I said, the expert do the expert job. Let's hire an accountant and let's find out how he or she would like to set this up. Should it be an LLC? Should it be a incorporation? Should it be an LLC filing as an S Corp? These are all things that we want to ask from the beginning. So the next step would be we need to obtain our professional license. If you're going to the state of Georgia, if you're coming for either your graduating residency fellowship or you're coming in from out of state, we need to make sure we have our Georgia medical license. Georgia's a composite medical board, so whether you're an MD or a DO, it doesn't matter, it all runs through the same process. And it's relatively straightforward. Georgia is one of the easier states to navigate the process of obtaining your license. So choose the entity type. That goes back to what the accountant would recommend. All practices now are starting out as LLCs or PLLCs, and we're doing a lot of conversions from older corporations into LLCs. That it is exactly there in the name. It's a limited liability company, so it's a protection of the owners that other entity setups don't offer. The practice name and the logo. This may seem straightforward, but it's actually one of the most time-consuming and fraught processes. What are we going to call our practice? It used to be Dr. John Smith, MD, PA. That's what everybody called it. And so, but that's gone away. People understand and the value and the concept of branding now. And so you may not want to refer to your practice just as the physician name. It may be something more, something that's brandable and something that will live on past one individual physician. We'll register the name with the Georgia Secretary of State, register any DBAs with the Secretary of State as well. Those need to be done. So to ensure you're not taking someone else's name or someone can't come and take yours. We'll apply for your tax ID number. And this is an important step just because of the document that you get when you apply for this number. It's called an IRS CP 575, and it's something that needs to be held on to because Medicare is going to ask for it, Medicaid is going to ask for it, and some insurance companies are going to ask for it for you to show that you're the actual one that owns this practice. Obtain your DEA. That's a straightforward process. Needs to be done after you acquire your Georgia license. Even though the DEA is a federal organization, it's run on a state-by-state basis, and so just because you had a DEA in another state does not apply to any medical practice that you perform in the state of Georgia. So location. This is it's very crucial. It will depend on what your practice specialty is. Things like primary care are pretty hyper-local, and so it's going to make a big difference. People will seek out more specialized care and be willing to travel further distances for something that is more specialized and comes up less frequently than routine medical care. A great way to do this is go to the insurance company websites If you go to unitedhealthcare.com and act like you're a patient, so you want to start an OBGYN practice. Okay, well, we're thinking about starting in Noonan, Georgia. Okay, great. Let's go and look up how many other OBs are in Noonan, Georgia. And Anthem's website will do that. Humana's, United Healthcare, that gives you a lot of information, because you don't want to be in a heavily saturated area. That could not only affect your competition or where you stand in the marketplace, but also oftentimes we'll face closed insurance panels. The primary care, for example, is something that's closed in heavily populated areas because they deem they have enough. And so if you are in a less saturated market, you are much more likely to not only be able to get the insurance contracts, but negotiate them at higher rates. Next step, once you've determined the location, we do need to have a phone and a fax number, because you need those three things. You need an address, a phone, and a fax to do anything, start the contracting credentialing process. We'll have those. Then we apply for Medicare. Medicare is the first thing we usually do after you get your group NPI, and apply for your Medicare process. It goes through Palmetto GBA in South Carolina in the state of Georgia. Takes about 3 to 4 weeks if everything's done correctly. If things aren't done correctly, the process can take 4 to 6 months. When they were return for corrections, and you got to go back and forth with them. And so it really pays to do it right the first time. We can do your Medicaid at the same time you're doing your Medicare. And Georgia Medicaid is also just like the licensure process. It's very straightforward. An advantage of Georgia over other states is when you apply for your Medicaid, you can choose whether you want to participate with all the Medicaid HMOs, whether you want to do CareSource or Peach State, and they will take care of that process for you, that credentialing process. Not many other states offer that service. So we'll begin once we get our Medicare and Medicaid numbers, then we start the insurance contracting process. What our group does is we reach out to the insurance companies on your behalf, United Healthcare, Anthem, Humana, Aetna, example, and say, this is who we are. We'd like to contract. This is what we do. Here's where we are. And they'll either say yes or no. And most of the time, most panels in the state of Georgia are open. And then they'll say, okay, here's your contract. And we say, thank you very much. But what we think the guy down the street is being paid is a lot more than what you're offering. And so we'll negotiate the rates up. Some initial contracts are non-negotiable, but a lot of them aren't. And most people will just sign, great, we're in network with Aetna, sign the contract and move on. Well, if you can get a 20% rate increase over what they offer you, that makes a big difference, especially in the first year of your practice when money's kind of tight. And so we always try and negotiate the contracts. We think it makes a big difference. Sometimes it's successful, sometimes it's not. Your practice may require a CLIA certificate. This is if performing any laboratory tests. If you're in primary care, internal med, you want to perform rapid strep, urine pregnancy, A1Cs, for example. And if you want to get paid for those, you need to have a CLIA waiver certificate. If you're doing more advanced laboratory procedures, urinalysis, anything that qualifies as parts per million, then you need a further CLIA license from that. And so we certainly all help with that. It's not fun when you go to perform these tests and submit your claims to United Healthcare, for example, and they say, sorry, but you don't have a CLIA. We're not going to pay for it. Thanks for doing some free lab work. Developing the budget and cash flow projections. It's important because you have to realize what your biggest costs are going to be. Number one, your cost is going to be rent. Number two is going to be payroll taxes, and number three is likely going to be your medical supplies. And so what I recommend is for physicians starting a practice, you need to prepare not to take a paycheck for about 3 months. And so we need to make sure we have our cash reserves, and we can help budget out what staffing, what rent, what all this is going to cost for about a year, and make sure that we get with the right lender that has favorable terms. There's actually Bank of America team out of Atlanta is a great resource if you have an MD or a DO behind your name. They get it. They understand that their return on that investment is pretty secure. And so, we always we can help with financing and get you set up with the right banker relationship. Selecting your EHR or your RCM service. EHR is electronic health record. RCM is revenue cycle management. They're kind of the same. Most products will offer both now. It's a health record and a practice management system all in one. The most important part of this is making sure it's functional for you, the provider. If it is clunky and cumbersome, and it causes delay in you being able to close your notes, close your encounters, and therefore get claims out the door, then it doesn't work. We need to find something that fits with what your practice wants it to look like. The practice management systems used to be very disparate as far as whether they were good ones or not. They've all kind of risen to the top. And so making sure that the functionality of the system works for you and your practice is the most important part. We typically will demo about 4 to 5 services and see what they offer. Some have internal billing, where Athena, for example, will they take care of your billing for you? May be right for your practice, may not. If I've never seen billing get outsourced and then have it actually collection rates go up, but maybe that's changed. We'd have to see. So we do need to do all the other things that that Donnie would be able to help with. We do need health insurance, employer offered health insurance if you plan to do that. You do need workers' comp, you need general liability, and you need medical malpractice, professional liability. All credentialing, all insurance companies are going to require that, and so will Georgia Medicaid. We need to make sure we're properly covered. And so having a good insurance agent, someone that's on your side and someone that can be really forthcoming, you always be honest with your attorney and your insurance agent. So having that protection in place really is a requirement. If we want to join any medical associations like Medical Association of Georgia, it's always good. If you want to do something that's more specialty specific, you can certainly do that. It's a great way to connect with people. I found that when people have billing questions, it's great to connect with these societies, things that aren't directly related to the practice of medicine, but actually the business side of medicine. These are great resources. People have already felt the pain and done the homework to fix it, and so those can be great resources. If Georgia requires state income tax, this doesn't apply to all states, but we need to make sure that we're registered properly with the Secretary of State. Your equipment and furniture. You know what you need to run this medical practice. We want to try and run lean as long as we can. If we don't need to have that ultrasound machine yet, let's build the practice up a little bit before we invest in the more particularly expensive equipment. You don't have to buy new stuff. There's a great secondary market. Practices go out of business, physicians retire, offices close, and so there's it's great to be able to look at things like eBay and look for used exam tables, for example. Those things are built pretty solidly. So okay, let's pay 10 cents on the dollar for it. Your computer and billing system, that's going to go along with your EHR. Most of them are cloud-based by this point. It's very rare that you'll have an on-site server or even a server dedicated to yourself in a data center somewhere. And so just make sure that you have functional computer equipment. It helps to have all the same equipment so that you can learn how to work on one, and it helps you work on all the rest of them. Phone and internet. Obviously, that needs to be. Those are usually one system now. You pay Comcast or Spectrum, whomever it is. They usually take care of all that for you. We need to make sure we have the right connectivity with enough bandwidth, because a lot of if you've got 15 people in your office all working on the internet at the same time, sometimes that can bog down. We need to make sure we have what's adequate for our needs. And as I mentioned before, we do need a phone and fax to start any credentialing process. So even if you can use web-based phone and fax services like RingCentral or even Google Voice to get yourself a number and then port that over once you decide to start paying for the internet. There's no reason to pay internet for 4 months, phone and internet for 4 months before you start the practice up. If you can turn it on 2 weeks beforehand, sometimes that can save you some money. Systems for communications lab results. This is usually your Quest and your LabCorp. You want to be able to get these results, so they'll usually help you set that up. To give you portal access. Same thing with your hospital systems, imaging centers. If you send somebody for an MR over to Piedmont, you want to be able to get those results and not have to wait on the patient to bring a CD back to your office, for example. And so let's make sure we get all those items set up so we can have access. And not only do we have access to their stuff, but if we can interface with theirs as well, so that it's a great way to refer patients back and forth. Encounter forms and stuff, things that you sign, most of these are electronic now. So your EMR may offer an online portal to register, for patient registration. Sometimes people like super bills, though. Physicians still like to hold something in their hand, mark off what they did, and it's a great way for codes not to get missed. If you if you perform your 99204 and you did an EKG, well, let's not miss that EKG. It'll get us an extra $36 on your visit. So oftentimes it helps to have something in your hand that you can mark off everything you've done. Policy and procedures, these are important. These are legal documents. And what you would want is, for every role in your facility, if you had to drop somebody brand new in that day, could they look at your policy and procedure manuals and do the job? And so that would be a successful policy and procedure manual would offer that ability. It's obviously it's not going to happen. You hopefully wouldn't drop someone in with 0 days of training, but could you? And if with a successful and comprehensive policy and procedure manual, yes, you should be able to do that. Hire and train your team. We usually like to start this about 1 month out. You'd want management. You can get by with an office manager. You don't need CEO level people. You'd like to have somebody that runs the front and someone that runs anything back office, clinical related. There are formulas. Do we really need 3.4 employees per provider? Probably not, especially not in the beginning. And so be prepared to ramp up. My philosophy on hiring and firing is, if you have hired someone, looking back, if you could go back to the day you hired that person, would you do it again? And if the answer is no, that person needs to go. That could be a physician partner, could be a nurse practitioner, could be a medical assistant, could be the cleaning crew. But keep that in mind, that there is no role that where someone's invaluable. We do a website's very important, because it is your I'm open for business sign that's on 24 hours, and it's the way that people get their information. So you want to have an elegantly designed, informative website. Here's who we are, here's what we do, here's how to find us, here's how to make an appointment. And your bio on your website is I found it to be very important. You want to personalize yourself. And so this is, I'm a human being, here's what I did, here's what I love to do. You want that patient to know before they set foot in your office that they've already made the right choice in choosing you for their physician. And that goes along with your marketing strategy. How are we going to get out? How are we going to get the word out? Who we are and where we are, and here's how to get in touch with us. And a lot of times that takes us to referral sources. If you're a surgical specialist, you'd want to meet your primary care doctors in the area. You'd want to meet people that could refer over to you. A great way to do this is to perform grand rounds. And so, it's heavily populated by physicians that need their CME. Come in and say, give a presentation on something new that's going on in orthopedic surgery this year. It gets your name out there. They get their CME. It's better than any billboard than you could ever imagine. Get out and meet with the people, meet with the community. And then we'll, by this point, all your contracts are back in, you're credentialed, everything is set up in your EMR system. You plan an open house. You do want to show off your facility. You put your heart and your money into this facility so that you can have a place where you give good care. Let's show it off. And then obviously we'll start taking appointments, we'll get down to business, and then we'll review we'll make sure that the bills are going out and that money is coming back. It takes a little bit, probably takes about a month for money to come in once you first get started, but then things will be moving along. Anthem takes about 2 weeks to get in, UnitedHealthcare about 2 weeks, Medicare is the same. And so we need to make sure that our claims getting denied? If so, why? Are claims getting responses to them? Are they getting adjudicated? Are we getting paid? Because you guys can choose how you want to volunteer, but I would not recommend volunteering your medical services if you're trying to stay in business. So if anyone has any questions or would like any assistance, I'd be happy to help. There's my contact information, the website, and my email address. Sometimes you may need our help, sometimes you may not. If you just want a copy of our checklist to start up, drop me a line. I'd be happy to send it to you. Reach out to us for the problems that you guys can't solve. A lot of this is you didn't become a medical professional by not being good, not being smart, not being agile and innovative. So, you do what you can. If you need help, if you're hung up on something, we'd be happy to help.
Josh, that was amazing. That was very good. Thanks a lot. And our next speaker, I do have a couple of comments and questions for you, Josh. One is, there's another Florida company. You mentioned image sharing. There's another Florida company that makes that really, really easy with no CDs, all web-based. It's kind of patient-centric. And I think they're even part of the CVS chain now. It's called mymedicalimages.com.
Mm-hmm.
And we don't have a relationship with them, but they really make image sharing very easy for small practices. There is another Medical Association of Georgia partnership that really helps, especially when you're starting out. In fact, they guarantee new patients in 30 days. And that particular company is out of Pittsburgh, and they're a friend of the director, Jeremy Bonfini, and they're called practicebeat.com. And their expertise is kind of website Google speak. They speak Google so incredibly well that they guarantee new patients. And then the last thing, of course, is that if any new practice person wants help with compliance, we at VentOps stand ready to help. We do both OIG, HIPAA, and OSHA. Okay, so our next speaker will be Donnie Rice, who's the customer relations expert for the Medical Association of Georgia's insurance agency. He's got a couple of things he wants to share with us. And Donnie, do you need the screen?
Nope. All I need to do is just have me talking.
Okay.
Okay. Thank you, Mark. So once again, thank you, Mark, for having me on. My name is Donnie Rice with the Medical Association of Georgia's insurance agency. So what I'm here to do is help our physicians alongside Josh kind of create that one-stop shop for being a member of MAG. So alongside getting your practice started up, I also want to help you, just get all the other little checklist items underway. So with MAGA, you have your big three heavy hitters, which is MedMal, health, and then personal asset protection. So alongside with MedMal, just to let all of our physicians know, and incoming physicians, we use Medical Protective. Medical Protective is a Berkshire Hathaway company that's been around since 1899. MAG uses them because of their strong claims defense teams, as well as by using MedPro, you also get a discount on your premium if you're a MAG member using Medical Protective. And alongside that, if you would like us to shop around for you, beyond Medical Protective, we do have a wholesale broker that can shop for many different carriers from around the country. Some names I know a lot of physicians know is MAG Mutual, the Doctors Company, SBMIC, Coveris, Kinsale. We can go to many different markets just depending on how your practice works. Alongside medical malpractice, so of course we have health services. We use Decisely out of Alpharetta, Georgia. They can help you with group and self-employed health plans. And mainly what I like to use for our physicians at MAG is Anthem Guaranteed Issues via Blue Cross Blue Shield. They have a very quick and easy quoting system. So just one call or one email to me and we can get you a quote within minutes with them. And then alongside MedMal and Health, we also have Life, which is personal asset protection and business preservation with Synergy Financial Partners, another partner of MAG. With them, we're able to help you do buy-sell agreements, employee and key person, home and auto, living benefits, life insurance, and creating your own pensions outside of work. And also too, by using their personal asset protection, it avoids probate. And also gives you a tax-free access and cash accumulation with some of their products. And of course, all three of these things for MAG members are at no cost when it comes to finding out information. A lot of times people will have to go out to find their own personal financial advisor and have to pay them fees just to find out some of this information. But with your MAG membership, you're able to come talk to me, give me a call or shoot me an email, and I'm able to shop or find out this information for you and just give you some numbers to have in your head so you understand if you were wanting to use MAG as your marketplace, just have numbers so you understand what prices should you be looking for or looking at. And of course, being a MAG member, you also have a litany of other benefits that Mark was mentioning. We have Practice Beat, increasing your market share, preventing patient leakage, and making you that top Google search when people type in endocrinology, urology, cardiology, any time a potential patient types something into Google. Practice Beat makes sure that you are that first web search, so people are consistently going to your practice. And I've seen that time and time again, doctors and physicians who have not really even been on a Google search. Now, when you look up their name, they're right there, right in the top of the list. which always brings in a lot more new clientele. And then alongside that too, we also have the new MAG MasterCard, which allows doctors and physicians to take hold of a 2.5% cash back on purchases of medical supplies. And of course, the MAG MasterCard has no effect on your credit score either as a physician, so there's a lot of benefits of being a MAG member. They're not just solely medical malpractice. We have many different things that we're able to help our physicians out with. So of course, if anybody wants more information on that, please just go onto the mag.org website, and you'll see all my contact information. And since I am on here, I will give out my personal cell phone number for any doctor or physician that's on this call or watching this call later on is 470-446-4198. If you ever have any questions or concerns about, I'm paying too much for this, I'm paying too much for that, I need help with home and auto, I need to find, what was Josh Eakin's email and number? I'll be able to help you out as a one-stop shop for any sort of questions that you have for indie practice or for MAG's benefits. And that's all from me, Mark. Thank you.
Very good. Thank you, Donnie. That was really informative. I thought of one more thing before we go, and that was a reference to medical images. I recently met a company out of Utah called Glendor, which sounds kind of like a character from a trilogy of the Rings or something, or Mortal Kombat. And what they do is they have a software that you can install at your practice, which completely completely sanitizes or removes all PHI from documents and images before transmission. And this is particularly useful when you are submitting things for clinical studies or for research projects, because HIPAA being a big deal, you want to make sure, and it's very difficult to do that manually. So that's all I have. Josh, thanks again for participating. It was fantastic. Great job. Any last words on your end, Josh?
I appreciate the opportunity.
Excellent. Okay, with that, we will end the webinar. I wish everybody a very good week, and this recording will be available through the Medical Association for anybody that wants it. We appreciate the practices that joined us today. Take care.
Thank you.